Hello, everyone. It is me again, Dr. Ibe. I'm your platform medical advisor. I have had lots of questions and concerns from people that made contact, and I will try to address them as we go on. Let's see how far we can go. The first one was somebody who's diabetic, who got back to me saying that he has been experiencing pain, a rib cage pain, neck pain, slight sore throat, low back pain, and blurred vision and swollen ankles and legs. So the person wanted to know what to do. My advice would be with the rib cage pain, the neck pain, and the sore throat, that sounds like a flu-like symptom, which is, of course, a viral illness. It sounds like a flu-like symptom. However, I would strongly advise you self-isolate yourself with your loved ones, for at least 2 weeks and contact your healthcare provider, your doctor or your nurse. I'm sure he or she would agree with me for you to self-isolate. I don't think there's need for you to get tested for COVID-19. However, I would advise you self-isolate yourself. For the blurred vision, I would strongly advise you see your doctor, who will then send you to be checked for what we call diabetic retinopathy. Diabetic retinopathy is a screening we do for all diabetics once a year at least, where we make sure that the diabetes is not affecting their eyes. And if it does, that can be treated. If it's gotten on time, it can be treated as long as your diabetes is tightly controlled, is well controlled, because that can lead to blindness. And for the swollen ankles and legs, with labored walk, as you mentioned, I think you need to be checked for what we call heart failure. Heart failure is a symptom or disease where the heart has labored so long to walk because of the diabetes, high cholesterol, high blood pressure. That can be checked, and it's a blood test that needs to be done, and to send you for an echo of the heart, which means doing a check of the heart. And if it's heart failure, there are medications that could be given to make sure that can be reversed. If all that had been done and you don't have heart failure, then you can start looking for other causes like arthritis and so forth and so on. Somebody also got back to me, wanted to know what is cystic fibrosis. If you guys can remember, initially in my first video talk, I mentioned about some long-term conditions such as cystic fibrosis. Cystic fibrosis is a fibrotic disease where what we call the exocrine gland, they secrete this thick mucus that can block the lungs and causing repeated infections. So if you have that, it can affect other organs as well. Obviously, we are not talking about that, but it can affect the lungs, causing repeated infections, which then can make you vulnerable to this COVID-19. Some other person said, how can I be tested for COVID-19? It depends on where you live. Like in the UK, we are just testing only those in the hospital. There's no mass testing. Some countries in Europe are testing everybody. Some countries are just testing those who've had contact with someone that has a confirmed COVID-19 diagnosis. They do contact tracing and make sure they are all isolated, and those who present with symptoms can then be tested. Yes, I have lots of questions and concerns which we shall continue in the next series. Please blow your nose on a tissue, sneeze on a tissue, cough on a tissue, after which dispose of the tissue, wash your hands with soap and water for 20 seconds. Please wash your hands with soap and water for 20 seconds. The more the merrier. I wouldn't stop talking about that. And please maintain your social distancing, which is 2 meters or 6 feet apart. Please maintain your social distancing, which is 2 meters or 6 feet apart. Please be safe, play safe, protect yourself and loved ones. Please be safe, play safe, protect yourself and loved ones. God bless. Bye.